I want to thank all of you for being here so early. I want to thank Dr. Sullivan for making sure that I became the Surgeon General, and I kill you sometimes for that. I want to thank Dr. Foster for being the moderator and really taking good care of me. And I want to thank Roy, because I met him a long time ago when he was young and he didn't have white hair. But at this stage of the game, we were asked, and I like to thank Dr. Murty that sometimes I think he could be my son, but he's behaving pretty good. So I want to talk about disparities because this was something that was there during the times that I was Surgeon General. And every time I look at the way that we are, I remember that it was almost 25 years ago that I was Surgeon General. I was a very young person. And I have the feeling, like Joycelyn says, it's not that we're getting fat, it's that this stupid laundry is getting this uniform smaller. So in this United States of America, we are 318 million people. We are 63% white, 16% Hispanic, 13% African Americans, 5% Asians, 2.4% multiracial, and 0.4% Native Americans. 38% of the United States is minority. And by 2060, it will be 56%. For the lady that asked about being minorities or not, we are the emerging majority, and in the year 2043, the white majority will be gone. Until then, we have to wait. Today, 46 million Americans are poor. It's the largest number in the last 54 years. 106 million live close to poverty. 20 million live in deep poverty. 17 million are in food insecurity life. And when you look into that, 27% are blacks, 23% Hispanics, 9% are white, and 0.5% are Asian. So I think we are in a threshold in America. It seems to me that which way do we go? Do we continue the old initiatives, or do we move in a new direction? Hippocrates said, extreme illnesses require extreme remedies, and I think the time has come for us to have an extreme remedy to something that, as the time I was Surgeon General, we have been talking about it and doing absolutely not enough about it. Martin Luther King said, the ultimate measure of a man is not where he stands at moments of comfort and convenience, is where he stands at times of challenge and controversy. It seems to me that we are in a time of challenge and controversy because the people of racial and ethnic minorities have not really gone very far in the last 200 years. I think it's time to candidly admit that in the year 2015, we still have a long way to go. So if we have learned anything about eliminating disparities, it's not an easy task. And the most important thing is you have to break the root causes that is getting us there. The poverty, the lack of education, the lack of economic opportunity, the lack of health insurance, no quality health care, discrimination, and in the African community, distrust of the system. In our quest to address this, people forget that the barriers is not only poverty. For some people, there's no time to take off from work to go to see a doctor. There's no transportation money. There's no buses. There's no navigation in a healthcare system that is complicated. It's not only follow the yellow line. And on top of that, if you happen to have a face that does not look like the one behind the line, they speak loud, like if being a minority means you're deaf. Then you have to ask the people who live in the communities, and they will tell you. We, the people, minority in this country, live in a place where healthcare people do not know my language. They absolutely do not know my culture. They do not give me the same education and respect, and worse, when they have the treatment that is high technology, I do not get offered it as the same as the white people with the same insurance. So the most important thing we have to do, we have to use the power of information. If you don't tell people what they need to know, how in the world they're going to know it, especially when minorities get their news 67% of the time from the radio or from the television. And more than anything, if you tell people what they need, 91 million people of us will be able to trust you and will never turn away anywhere else to get their knowledge. So how are we going to accomplish this business? The most important thing that we have to do is socioeconomic causes and health disparities have to be addressed. We know that health, socioeconomic, and education go hand in hand. If you do better for education, the health would absolutely get much better. But more than anything, according to the Centers for Disease Control, 4 times as high persons living below the poverty line will really have complications in their health status. So when you look into this, Today in the United States, if you have a high-income group, you are going to live 6.5 years more than the ones who do not have money. And if you're a college graduate, you absolutely will live at least 5 years more than the average person. So education is going to be very important. So health, education, and income go hand in hand. If you have no high school, you will earn $24,000. If you have only high school, you will earn $35,000. If you are a bachelor's, $64,000, master's, $81,000, and a professional degree, $115,000. So I have to tell you that education has a lot to do with what are you going to do with your life. So educational attainment is something that we have to look, but when you look at the numbers, my God, where are we going? If you do not know where you're going, you are already there. So when you look into high school, 75% of Latinos and 70% of African Americans get their high school diploma, but 15 years less than the average United States, which is 81% graduation in high school. And when you go to college, the whites is 40%, the Asians is 58%, the blacks is 20%, and the Hispanics 15%. Graduation matters. The unemployment of the persons with no college is 17%, and even when you have college, the unemployment is 7%. So when you look into this, I figure, what is going to happen for us to get beyond the high school? And let me talk to you about the people of us that is going to medical school. The Council of Medical Education said, although minority physicians are more likely to practice in the areas of the neighborhoods where they feel more comfortable, the recent figures of minority applicants and enrollments in medical schools have a lot to desire. According to the American Association of Medical Schools, 6% of African Americans matriculate, 4% only are practicing, and of the African American doctors today in the country, only 3% are male. And 2.3 really are men, and 3.8 are female. So when you look into that, why in the world are we just making sure that you tell me I need to be a doctor in medicine, and then you make me apply to medical school, and then you don't choose me? Something has to be done regarding that. And more than anything, it has been shown that African Americans tend to prefer the physicians with their own race, and more than anything, we give them 2 more minutes of time. We have cultural sensitivity, and we have interest and responsiveness, and we might even know their name. Remember, consistency in relationship with your primary provider helps minority patients with the mistrust of the system, especially when you try to bridge the cultural and the linguistic gap. So more than anything, I say that you have to have more sensitivity in medical school. To begin, I think we have to address the education of physicians. Cultural sensitivity has to be the center of medical school education today. I have to believe that that's the case. Let's face it, we come to medical school with 25 years, and in those 25 years of experiences, there is bias, whether it's gender or whether it's racial. And if medical school's training do not address this, then we're always going to be the problem rather than the solution. And believe me, I say sensitivity, not competent, because we get in there by being competent. So let's improve the communication skills of physicians, how to interview them, how to care for them, and by all, do not judge them for what they say, and share their cultural values. The reality is that there are 14 million people in the United States that do not know a word of English, and they also need to be addressed. Patients always are telling me, doctors see me too quickly, they speak words that I do not understand, and I'm so embarrassed to ask them for them to repeat them with the fear that they might think that I'm stupid or dumb. And more than anything, give them the information that they can understand. The focus in medicine today is fix it and heal the sick. The time has come for us to do more than the fix approach. The word doctor comes from the Latin docere, which means teach and instruct. I think the time has come to get the teacher back into the doctor. Remember, one thing that is the one that is most devastating to me, and perhaps it might help if we put all our efforts together, and might be not the easiest to fix, is what I call the barrier of institutional racism. The maintenance of disparity that is caused by the actions or the practices of institutions. I have been told that private patients can see their doctors in the private offices any day, any time. But the poor patient can only see their doctors only in the clinic on appointed times. And so there's a 2-tier system in which the doctor of a private patient sends a note or calls immediately the referring physician once he has diagnosed the referral, where the clinic patient sees a resident in training, and most times there is no follow-up. And even more commonly, the next time it might be a different resident, a different clinic, and a different day. Could it be feasible to say that the reimbursement system unintentionally might be relegating the poor people to be served by institutions, training clinics, and teaching hospitals rather than granting them the same access to same facilities and systems of care utilized by the paying majority? I know that this is not for us to ponder, but I do believe that it's also a hindrance. I wonder what message we're giving the new medical students. Training, what good will it do to train them in cultural sensitivity and competence when they will be sent to work in institutions where from the first day they will find themselves working in systems that teach them that the poor is where you learn medicine and the rich is where you learn billings. I have the feeling that we have to be committed to provide high-quality medical care with our own clinics. As clinicians, you have to do more to ensure that the private practices have to also help the ones out there. Better services for people in the absence of better hours, it will not suffice. Our patients have to be partners, not supplicants of care. So where do we go from here, you may ask me? And I believe that eliminating disparities will take time, one at a time, one disease, one health center, one neighborhood at a time. But whatever efforts we're going to use would be no less profound than the efforts required during the first civil rights movement, efforts that were responsible for transforming the society at large. And one of the things that I did when I was Surgeon General, I did the Hispanic agenda. The time has come to have the African America health agenda totally separate from everything else. The blacks in the north are not equal in the needs of the black of the south, nor the east, nor the west. The time has come for us to divide the country in four, find out what are the needs, and then take it forward. I suggest that the Surgeon General and the Office of Minority Health draft the health agenda of the African American of today. And believe me, we will move much further because it will be in the eyes of those who can make a decision, and it's not just words in the sky. Make it education, make it health, make it data. If you do not know who we are, how can we plan the system of care for the people? Do not get complacent just in the healthcare reform. You have to move farther than that. So how are we going to begin? You're going to fund projects in the community, involved with the people in the community. You're going to make sure that you're going to define the programs very, very comprehensively. Then you're going to find institutions that have a sense of collaboration, and then you're going to provide the money for the funding. But more than anything, you're going to make sure that this is a long-term problem, so you're going to offer long-term solutions with long-term funding. There's nothing more distressing than to be able to have your grant and then make it stop in the second year when your ideas were just going forward. So get involved in frequent evaluation of the process and make sure that you get the outcomes that you deserve. Remember, Shirley Chisholm used to say, most Americans have never seen the ignorance, the degradation, the hunger, the sickness, and the futility in which many other Americans live. They will not become involved in economic or political change until something brings the seriousness of the situation to them. It seems to me that we Surgeon Generals have brought the situation to you. But I want to leave you with the words of Yehuda Bauer, the great Holocaust historian who said it best. And he said there should be 3 extra commandments to the ones we cherish and we honor. And the first one is, thou shalt not be a victim. The second one is, thou shalt not be a perpetrator. And the third one is, thou shalt not be a bystander. Don't let anyone say that enemy has ever been a bystander. Thank you very much.